Good morning and a very warm welcome to day 2 of CRAN's 5th annual Pan-Tumor Early Age Onset Cancer Symposium. To those who joined for yesterday's sessions, welcome back. And to our new audience members participating today, a warm welcome to the event. We are so pleased to have you all join us and learn with us throughout this symposium. My name is Cassandra McCauley, and I am the Chief Research Officer at CRAN. It is my honor to guide you through this symposium programming again today. For the benefit of those who were not able to join us yesterday, I'll just dedicate a few minutes as we get started today to some introductory and housekeeping remarks. This year, the symposium is focused on advancing sustainable and personalized care for early age onset cancer patients by addressing systemic barriers to improve outcomes. Yesterday, we explored opportunities through a clinical and policy-based lens, and today we are looking beyond the diagnosis and we're elevating patient and family voices to improve outcomes in early age onset cancer. We are so grateful for your engagement this morning, and we really look forward to bringing you another great day filled with tangible learning opportunities and discussions centered around a path forward to ameliorate patient experiences and outcomes. For those with whom we are not yet acquainted, I will just very briefly introduce CRAN, so the Colorectal Cancer Resource and Action Network. We are a national, not-for-profit, patient-focused organization, and we champion the health and well-being of Canadians touched by colorectal cancer and other tumor types, as well as those at risk of developing the disease. We provide support, education, and advocacy to patients and their caregivers to help improve quality of life and longevity. CRAN has formally expanded our patient-focused mandate, and again, we are serving multiple tumor type patients with the ultimate goal of reducing the burden of cancer in Canada. CRAN has an entire mandate dedicated to early age onset cancer. Across tumor types, CRAN aims to promote best practices in early age onset cancer detection and diagnosis, while improving the treatment journey through access to advanced diagnostics and therapeutics, as well as unique models of care tailored to the needs of early age onset patients. As an organization, we are absolutely dedicated to raising awareness of the rising incidence and prevalence of early age onset cancers, and unfortunately, that rise is happening across multiple tumor types. Yesterday, I introduced our 2025 steering committee, and I do want to take a moment to extend CRAN's gratitude to them today as well. Our sincere appreciation goes out to the steering committee, who have guided the development and implementation of the programming this year. On day 1, we talked a lot about system-level priorities and clinical innovation. Today, we're shifting our discussions to the lived experience of patients and families. We'll begin by presenting the findings of a national pan-tumor patient survey, followed by a patient group roundtable discussion on the unmet needs of younger adult cancer patients and the role that specialized clinics or models of care can play in addressing these needs. After lunch, we're talking sexual health and financial burden, two significant areas of unmet need experienced by early age onset cancer patients and their partners. Through our last 2 sessions of the day, we will explore how cancer is experienced by young individuals from underserved communities, and then we will wrap up with a discussion on life beyond treatment before adjourning the 2025 symposium. Some housekeeping notes as we get started today. So at any time you can visit our symposium website, and here you'll find speaker bios and you can learn more about the programming and our partners. The agenda and patient resources are available using that downloadable resources button below the video stream. We also invite patients to take a visit to our My Early Age Onset Colorectal Cancer Hub. This symposium is being recorded, and all registrants will receive access to the recordings post-event. All of our viewers are automatically muted. However, we really encourage your engagement throughout the sessions, and we welcome you to submit questions, add comments using that comments bar just below the video stream there. We will address as many questions as time permits live with our experts, and then we'll follow up after the event regarding any questions that we did not have an opportunity to address live. In the event that you do require technical assistance, it will be kindly and promptly provided by our wonderful web hosting team, Digicast, using that help button in the bottom right-hand corner of your screen. I'll note as well that we will be sending out via email an evaluation just after the event today, and we'd be really, really grateful for your feedback. It's just a short survey. It will only take a few minutes, but it's really impactful in our evaluation of the event and our planning for next year. So we want to keep these conversations going on social media, and we'd really love to hear what you think through this platform as well. Please join us online at CRAN.org. CRAN is incredibly grateful to partner and work with a number of patient organizations who come together with one collective, resounding voice to amplify key messages and help expand our networks. Change is more impactful when we work together, and we are quite privileged to have the opportunity to work collaboratively with so many. Thank you, thank you, thank you to our patient group partners and colleagues who have supported the event this year. CRAN is also extremely grateful to our 2025 Symposium sponsors who support the improvement of cancer care for early age onset cancer patients in Canada. Thank you to our sponsors this year, Merck, AstraZeneca, GSK, and Innovative Medicines Canada. I also want to thank the individual partners within these organizations with whom we have the pleasure of connecting. I had the privilege of introducing our unapologetically passionate leader yesterday, and I am so pleased to do so again today. Filomena Servidio-Italiano is CRAN's founder, president, and CEO, and she is our team's equivalent to a morning shot of espresso. She has provided compassionate, positive, and life-changing support, education, and advocacy to so very many cancer patients throughout her almost 20 years in this field. And she is a visionary who has had meaningful and positive impacts on our cancer care systems in Canada. It is my great pleasure to introduce my colleague, mentor, and friend, Filomena, who will provide opening remarks and introduce a patient's story to kick off the day. Over to you, Phil.
I love you, Cassandra. Thank you so much for that lovely introduction. Good morning, ladies and gentlemen. A very, very warm welcome to day 2 of our Early Age Onset Cancer Symposium. To those of you who joined us yesterday, welcome back. And to those of you who are joining us for the first time today, you are in for a spectacular lineup of sessions dedicated to the patient voice, guiding system-level change to help improve the early age onset cancer patient's journey by prompting calls for change in public health policies, system-level practices, screening guidelines, and the introduction of specialized supportive care programs that address the specific needs of patients under the age of 50 years, including adolescents and young adults diagnosed with cancer. Based on yesterday's panel discussions, we became well acquainted with the alarming increase in incidence of early age onset cancers in Canada and globally across numerous tumor types. And this trend matters more than ever due to the profound personal, societal, and public health challenges it presents, including significant disease aggression, substantial life disruptions for young adults, and the increase in overall cancer burden on society, straining healthcare systems, impacting decades of progress. In addition to struggling to seek out the most effective diagnostics and therapies for their advanced or metastatic disease, younger patients repeatedly raise concerns about taking time off work and finding childcare while undergoing treatments. Due to their earlier life stage, younger Canadians with cancer often face or often struggle to meet their financial obligations without the backstop of savings or government-supported programs that seniors may have in place to cover their loss of earnings and to pay for treatments not covered by the public healthcare system, such as oral cancer drugs, for example. Feelings of isolation, loneliness, guilt, self-blame, anxiety, and depression abound relative to their older counterparts. It's absolutely heartbreaking to have reviewed the pan-tumor patient survey results, which we will be sharing with you today, ladies and gentlemen. To speak to some of these issues, joining me this morning is Katie Hulan, who in late 2020 started having a persistent cough that slowly worsened. As a healthy, active non-smoker, she never expected to undergo 6 months of inhalers for suspected asthma that was clearly not the cause of her symptoms. By the time she could barely speak due to coughing fits, a CT scan revealed a mass in her lung and was immediately sent to the ER, where she underwent several tests, and 6 hours later, she was diagnosed with a stage 4 lung cancer, which mortified her. Katie was 33 years old at the time. Her cancer had spread to her brain and liver, and she had been delivered a prognosis of just 6 months. But testing had identified a targeted therapy for her specific ALK mutation, which provided Katie hope. And indeed, that hope came by way of tremendous tumor reduction in just a couple of weeks after initiating therapy. Since then, Katie has experienced 2 disease progressions, eventually switching to a new targeted therapy. And thanks to advancements, she is still building her life, her career, and contributing to society in such a meaningful way by volunteering her services and advocating on behalf of those who have no voice. Katie lives her best life while continuing to treat her cancer. Ladies and gentlemen, I am honored, privileged to introduce Katie Hulan. Good morning, Katie, and welcome.
Good morning. Thank you so much for having me, and thank you so much for hosting all of us over days. It's fantastic.
It is absolutely our pleasure, Katie. Your story is so very inspiring, Katie, not only to newly diagnosed lung cancer patients, but to any young cancer patient undergoing the journey. Can we delve just a little bit into your journey?
Absolutely.
Thank you. So I have a few questions for you. The first of which is, look at that, you made me tear, Katie. I always tear when I speak to cancer patients who are so inspiring. All right.
Oh,
No, it's okay. So can you share with us what it was like to have received that diagnosis, that horrible diagnosis at such a young age? And can you tell us, did your young age have anything to do with a delayed diagnosis that took well over 4 months to confirm? Though I understand you had been battling symptoms for well over 6 to 9 months, correct?
correct. Yeah. So receiving the diagnosis was the most devastating thing I've ever experience. I went from having a side effect of a cough, which had progressed so bad that I couldn't even speak at work. I was working from home. I was on a Zoom call, almost, similar to this. And I was constantly going on mute because I could not get a sentence out. And aside from that, I felt good. And I didn't think a cancer diagnosis would be anywhere in my future. And to go into an emergency room, like you had mentioned in the intro to my story, and then 6 hours later come out with a diagnosis, the only thing I can say, it felt like grief. I grieved for myself. I didn't know, it felt so deeply sad and devastating. I had no energy. It was beyond what I could comprehend at the time. And it took, quite some time before I got to even the point where I can today reflect and speak about my initial few weeks. And, there's been difficulties along the way. And I would absolutely say that my age caused some likely delays. I was on puffers way too long and I wasn't having success. But I think being young with no traditional risk factors of lung cancer, cancer is just not something that a GP is likely going to think I would have at 33. And so I think when I was coming back saying, I'm really not getting better, there wasn't a really great next step other than to try another puffer. And that was a slight signal to me that, okay, it must be, I must be getting better. I must try this again. And I felt like I wasn't, my concerns weren't being addressed as well as possible. And this was my first time being so ill that I had to really advocate for myself. And I didn't know how to. I didn't know how to ask for something a little bit more like a scan. So I do think, even when I got diagnosed or the results back of a mass in my lung, nothing was said around, potential tumor, we need to do this. It might be a blood clot. It might be, I don't know what it is. And maybe that was protection, but it, going in, getting the results, and then talking to my GP after it did seem a shock across all of us. So.
And you were quite persistent. You were listening to your body.
Yes, absolutely. I knew something was wrong and I was worried about it. And it wasn't until we went to a respirology or specialist, I should say, and then that took some time. There's parts of our system that takes time in order to get to these appointments. And, it was me saying, can we do one more thing that's going to pinpoint this, please? I can't get through a work conversation. So there is persistence, and it wasn't an open door for me. I had to push the door open.
I recall you telling me that you had gotten to the point where you couldn't speak throughout a meeting because the coughing fits were preventing you from completing a sentence. Is that correct?
Correct. So when I was part of meetings, I had someone reporting into me and I had her come to more meetings and I gave her all my speaking notes because I knew I wouldn't be able to get through the meeting without constantly coughing. And that's not going to be a great outcome. I was really worried about my career at that point because I wasn't able to confidently do that. At the end of the day, I would be exhausted. My body would hurt just because I'm coughing or I'm just holding my body stressed in a way. So a weird side effect of a cough, but it was really intruding into, my day to day.
And that's what served as the impetus for you proceeding to the ER, was it not?
Absolutely.
Yeah. They listened at that point.
Yes, they did. It was odd to go to the emergency room during COVID and say, I have a cough, but I did a test. It's not COVID. So it was a complicated time to have a cough and to try to get care, but we made it through.
Okay. Thank you for sharing that. Your next question that I'd like to ask is a two-part question, Katie. You managed to access some really great targeted therapies for the management of your stage 4 lung cancer. These were identified because you were able to access comprehensive genomic profiling, better known as CGP. Is that correct?
Yes.
Yes. Okay. I'm certain viewers are interested in knowing how you managed to access that diagnostic and where. And as a young wife with a wonderful career, can you share with us
if there have been any unmet needs along the way that could be or could have been improved upon?
Great
Let's
questions.
do CGP first, okay?
Yeah, so I was living downtown Toronto at the time, and I was at St. Michael's Hospital when I went to emergency room, and then I stayed within their oncology unit for the first few days. A biopsy was done, testing was sent out. I did transfer over to Princess Margaret afterwards. And this is a conversation around sometimes it's where you live is where you get the best care. And that's one thing that I will always speak about, because what I received, even beyond that, is a really good scenario, and it was still hard for me. And so making sure that it doesn't matter where you live, that you can access what's available to us. It's so important.
Okay, so you managed to access comprehensive genomic profiling at the Princess Margaret Cancer Center, and that identified an actionable mutation that allowed you to access a precision medicine that essentially allowed your cancer to respond miraculously almost.
It was phenomenal. Within 2 weeks, I would say within a week, my cough had subsided a little bit.
Wow.
2 weeks was it was back to just a little clearing of the throat, a bit of a cough, but I felt I had my life back. And then a month in, I had a scan, and just my cancer had receded so significantly. And that gave me hope. Until that moment, I was still living in, I might see the end of this year and trying to close out my life, but that turned everything around for me.
Wow. And any unmet needs that you've identified or that could be improved upon?
Yeah, I think across the timeline, there's many different things. So at first, I was trying to think, okay, well, I don't have kids right now. What does family planning look like? And that was a very difficult question to answer, because at first we didn't know I was going to go on the targeted therapy when I started to have the conversation. So it was a bit of an empty conversation until we knew what was going to happen. So I started off with radiation, more as a palliative motion. And then it was question mark chemotherapy, question mark something else. What's the plan? And as we were waiting for test results to come back, we proceeded with radiation. And so I found it was hard to get answers. I couldn't get an answer, and that's fair to try to speak to someone on that. But once I knew I was going to go on to targeted therapy, there's very little research right now on these targeted therapies or each specific one, how it impacts, because there's just not that many of us taking it really. And not a whole lot of focused research. So it's a difficult question to have. And I was debating, do I get my eggs frozen and delay treatment, or start on treatment? And my husband and I just said, if I'm not alive, no kids are going to happen. So, and it was just a weird session to go through and have that conversation. And it was really difficult. So I went ahead, but it's something that was really difficult to make that decision. And it felt like it was on us a lot of the time. There wasn't, someone else I could talk to. I felt like I needed more conversation. And then outside of that, I was debating to go on short-term and long-term leave and how to do that with work. My concern was I knew the cost of the targeted therapy was going to be very high. It took 2 weeks of talking with my private pay insurance provider to get it approved. And at that point, it was 90%, meaning I would still have to pay $1,000 a month. And thankfully, there was if you went through Costco pharmacy at the time, they would pay the additional 10%. That was just a lucky finding on my part. So if I went on short-term leave, I had to do the calculation of the lower pay, then the higher payment out of my expense of $1,000 a month if that wasn't covered. And to do that all while thinking, how long do I have this devastating disease and this devastating diagnosis? It was just all very difficult. So I would say family planning, the financial planning around short-term leave, long-term leave, cost of care, any additional medications that I had, some were covered, some were not. So to me, it was trying to navigate all of those things at once and still working, still going to appointments every day or so with radiation. It was a lot. And then as I've kind of moved on and gotten to a better spot, I'm still doing tests every 3 months. And, as someone in my career, it can be disrupting or hard if I'm constantly having to go to appointments. And they're not every 3 months, it's 3 tests, 3 months. So it's almost every month. And then I have multiple calls. And so managing that on top of a schedule is always difficult as well. And so these are just things to consider. I like the phone call option just to make it flexible for, and how easy it is to book something. Those are things that as a young career person, if I'm traveling for work or, I'm thankfully able to do that now. Like this is such a privileged spot to be, but it's a lot of management, especially if there's progression, which I've had twice over the last 2 years.
Yeah. All right. Thank you. Thank you for sharing that.
Yeah.
And I guess we all want to know how you're doing today. And we also would love to hear from you if you could provide any newly diagnosed patient, young patient, with a piece of advice. What would that be?
Well, first of all, I would love to say that I'm doing very well. I've had really great scans this year, just very minimal disease being detected on my scans, which is the best scans I've had out of all 4.5 years. So thank you.
Outstanding, Katie.
It's great to celebrate with you all and continued success there, I hope. And my biggest thing is what I found helpful when I was first diagnosed is that I made a small plan, a 2-hour away getaway with my family. And we rented a little getaway and we did it for a weekend. And it feels so big to do anything like that because you feel like you can't. Maybe you think you might be a little bit too ill or sick, but just have something lovely planned for yourself after diagnosis. Do it, make it happen. Those small moments, whatever makes you happy, got me through. And I can't say enough how those little plans that I made every few weeks just really made it better. So do something small. Don't say it's all over. Just make a plan.
Outstanding. Thank you. We can't thank you enough for sharing your lived experience with us. I know I speak for all when I say that we wish you continued success, good health, and the absolute eradication of that tiny bit of disease remaining in your body, dear. You are
It will happen.
I know. You are such a beacon of hope, and we are grateful to you for having joined us today. Godspeed, Katie. Godspeed.
Thank you so much.
Thank you. Ladies and gentlemen, we have some great sessions lined up for you today that will speak to early age onset patient needs captured through a national survey, the importance of establishing additional young adult cancer clinics across the country, navigation of patient needs that include intimacy, reproduction, fertility, and out-of-pocket expenses, exploring the cancer experience from marginalized populations, and ending the day with how we can improve the survivorship experience. So please sit back, enjoy, and engage as together we strive to improve care for early age onset cancer patients in Canada. Thank you, and back to you, Cassandra.
Oh, thank you so much, Filomena, for that wonderful introduction, and a big thank you to Katie for sharing her story. I've seen comments coming through where our viewers are noticing the parallels between Katie's story and Jessica's yesterday, commenting on how patients constantly have to advocate for themselves and they shouldn't have to fight to get a diagnosis. And I, wholeheartedly agree with that. We will be right back with our first presentation of the day. I will remind our viewers that depending on the browser you're using, you may just need to refresh your video stream in between sessions, and we'll see you there.